I'm doing today. Thank you guys for joining us with our talk on re-entering into the marketplace. Today we have Nigel Green, Steve Denai, and Jamie Vance. Let me do a quick introduction. Do it on Nigel first. He is just a great human being, and I'll read you his bio. Nigel Green is a sought-after sales advisor, author of Revenue Harvest, a sales leader, almanac for planning, the perfect year, and a widely regarded authority on improving sales teams' performance. He has worked with dozens of B2B sales teams across the globe, like Universal Health Services, Ascension Healthcare, and Reload, to more than double the sales results. With over 10 years executive experience ranging from Fortune 500 companies to early-stage growth companies, and his certification, talent optimization, he is sought after by executives to improve sales team performance. His insight has been featured in top business publications like Forbes magazine, Business Insider. As a consultant and advisor, he can help any sales team with big sales goals experience consistent sales growth throughout utilizing his 7 sales leadership principles. I'll say that, and also I just want to say that Nigel's been a huge influence on me in this field, and his book is great, and he's just a great leader in this field. Jamie Vance has been doing this for 16 years. He has been in so many roles in this field that it is almost too much to name. He is with the Vance Consulting Group now, which is a wonderful consulting group for all your BD services, all your marketing services, just pretty much anything you could possibly need. Jamie's your man, and just an overall great guy. Steve Denai, this was a pretty cool fact. 20 years of sales experience. I thought that was pretty good. It kind of let you know that we're a little grizzled in this field now, and he's currently VP of BD for Lakeview Health, which is a wonderful organization out of Jacksonville, Florida. And I want to start this talk off by saying thank you to Lakeview Health for setting up the Blue Jeans app, getting everything going for us. So big shout out to them. Thank you for that. You guys ready to get this started? Everybody ready? All right.
Absolutely.
So I'm just going to fire off. What are the steps we should be taking to re-enter the marketplace? In your guys' opinion, what are you guys, how would you set your team up for success? So you guys kind of see what you think about that. Go ahead, Nigel.
If you want to, yeah, I'll go ahead and share. It's become clear to me and in my practice that everyone is ready to get back to work. Sales teams are eager to get out of their house and get back on the street and see customers. We're all wired for engagement. But in doing so, it's important that we rethink entry back into the selling environment. And so I've talked to my clients and been a part of a couple of other groups learning from healthcare professionals and thought leaders on what it needs to look like. And basically there are 10 things that I think we all need to think about when we go to relaunch our team into the marketplace. And the first one is identify and gather the right people. So you've got a team, they're all across the country, they're working remotely, and assuredly you can quickly think of a few people that have stepped up in this time of crisis. So forget about title and tenure. Think about who has excelled, who's gone above and beyond, and you really want to champion them to be a part of your relaunch team. The second thing is it's important before you just go back to work that you confirm that your target market is still viable. How has the market changed? What's new? What's stale? What needs to be refreshed before you redeploy your team? The third is to assess customer sentiment. And I know Jamie's been doing a lot of work on this, but essentially the questions I'm asking my clients to think about are, what are the pain points of your customers that you used to address? Are those still relevant? How can you help them now? And what about the financial security of your customers and of your target customers? Is it still there? Are they worried about things that they weren't worried about 6, 8, 12 weeks ago? 4 is to evaluate the competitive landscape. It's certainly changed now. Number 5 is try to identify new opportunities. For many of you, it's been telemedicine. But what are new ways that you might engage your customer through technology? We're going to talk about some of that today. Number 6 would be evaluate your cash position. And so maybe you're not an operator of a business, but cash means a lot of things. One of the more important factors to cash is price. So how is your pricing going to compare now in a new environment? Is it positioned well to meet your customers where they are? The seventh one is going to be establish a go forward plan. And I know Steve's going to talk a lot about that. It's going to be very tactical, safety, predictability, measurability, a lot of things that are going to go into a go forward plan. And then the things that I want to spend a lot are 8, 9, and 10. Number 8 is communicating with clarity. I never have met a sales rep or anyone, in fact, that has left a company or a manager for lack of communication. So just think about that. Number 9 is showing up and lead. It's really easy to get stuck behind the computer in Zoom meetings all day and not showing up and lead. So what does that look like today for the virtual leader? And then 10, it's going to come down to execution. And you got 20 years of experience with Steve and equal amount of years of experience with Jamie to talk about what does it take to act and execute in this time. And it's really more about mindset. It's about making things happen. And really all of us here, it's about making change happen. So those are the 10 things that I'm working on with my clients. And I think it's a good jumping off point for our time together today.
Awesome. And as Nigel was talking about, I think the biggest thing from us here at Lakeview is making sure that a tactical plan for the reps was comprehensive. We've all been sitting in our houses for the last 2 months now, and it's at a point where we're chomping at the bits to go see people again. And it's just time for us to start figuring out a way to do that right. But we had the realization that if we just send 24 reps back out in the field with no plan, inevitably a dozen of them will have COVID and we'll have half of our sales force out. And that's obviously not great for the health of our team, the well-being of our staff, and of course the ability to continue to drive and grow relationships in the field. So what we did is we actually put together a 4-phase program to get everyone back in the field. That's intended for a couple of reasons. First, protection of the reps. Obviously, that's first and foremost. I want to make sure that the team that we have is safe as they possibly can be going back in their market. And then the second, of course, is getting these relationships grown. At Lakeview, between a third and a half of our outreach team has less than 5 months tenure with us right now. So basically the team started, they were onboarded, they trained, they went to the national meeting, they were in the field a month, and then they were on quarantine. So how do we get these folks who are very talented and tenured in the field but new to us back up and running with the motivation and passion of our product behind them? So I'm not going to go into hyper detail about this, but I want to highlight a couple of things about the phases that we had implemented, and more than glad to answer specific questions as we go on with this. But phase 1 was basically assigned for to be a month long. So if someone's state opened up for business in their phase 1 in May, the team members there are now in phase 1. So let's say North Carolina, where I'm at, I have 2 reps. We open up on the 9th. They're already in phase 1. And basically what phase 1 does is limits meetings to 10 face-to-face meetings a week, limits the time of the meetings to an hour, limits the distance from their house to under an hour. We don't want people driving 2, 3, 4 hours away and going to all these different communities, keeping them still close to their community. Obviously still no one coming back on campus for tours. And then for PPE, we've really allowed them to expense hand sanitizers and mail them all cloth masks. Now, as we go through phase 2, phase 3, all these things start to relax. 10 face-to-faces turn to 12, turn to 15. An hour turns to 2 hours, turns to 1 overnight a week, and things start to grow. But during this process, we were really thinking and working with our management team that that's probably not going to be enough. Again, we have a very new team. Cohesion and culture is really important. And what we had planned on doing is getting together as a management team in June to basically reset the year. So the first week of June, myself and my directors were all getting together to reset our year and what's our repriority and how do we take all the things we've built the first half of the year, even through this, and how do we continue that going forward? And like Nigel said, what is the game plan? What does our target market look like? Are there vertical markets that we're now going to perhaps put on the back burner, or are some more in the forefront? And that's all going to be brought to the team as a whole later in June as we decide to do a national meeting to bring everyone back together again. Now, obviously, to ensure safety for that, we're actually having a meeting tomorrow with our chief medical officer to assess the viability of COVID testing for our reps. And the intent is on some sort of regular interval, actually sending all of our reps to point-of-care COVID tests. So The intent for that's obviously twofold. If we have 24 people out in the field, let's say doing 10 appointments a week, and we find out 3 of them have COVID on their check, well, they obviously go into self-quarantine, and for them, they're able to get medical access sooner than they probably would have if they didn't even know they were exposed. But also, our being good community partners we want to make sure that if our reps test positive, they're not going on those 10 meetings a week, and exposing 60, 30 more people over the course of a few weeks. Like that in our industry would be a problem, right? Because we're all bumblebees flying around from place to place. If everyone in our industry all of a sudden got sick, that's going to provide bigger issues and bigger concerns. So we're looking at doing that for our team, and similarly with our national meeting, everyone gets tested before they fly out to it. Everyone gets tested when they get there. If the point of care test is positive, they get nasal swabbed, and well, they missed dinner that night, but by the next morning, as long as they're negative, they're good to go, and really ensuring the safety of our team. So this has had to spill over into recruiting and training and all these other things that we had normally done. But the positive of it is we're now able to do this in a hybrid world where apps like Blue Jeans and Zoom will give the reps more of ability to do the 10 meetings a week versus their normal 20 or 30, 10, 20 Zooms. And all of a sudden, we now have a balance and a reach that was different than before.
Steve, will you be including antibody testing in the testing regimen? So if I've had COVID and I've got the antibodies, is there a protocol in place for that?
That's actually how we're starting. So the point of care test does immunoglobulin G and M. So it tests the antibodies and exposure. If IgG is present, roughly speaking now, I don't get too technical. We're actually doing a whole webinar on this next week, but IgG is present, we're typically not concerned. That shows longer term exposure. IgM could still be within the last 10 days. So if an IgM positive is the result, then we'll do the nasal swab for active viral DNA.
I think the important thing to remember is that even in the presence of antibodies, it has not been concluded that you are immune. So that's the reason why there's these extra level of precautions, even if antibodies are present.
Yeah.
Well, yeah. I mean, the same stuff. It's kind of like we're going in on a phase system. So I love that you guys have the checkpoint and kind of like a phase system going in. I'm just piggyback off of this, and my thought is, how has Zoom, Blue Jean, active media, stuff like this, how do you think that's going to shift our marketplace going forward? And do you think it's going to be as valuable as it is right now? Whoever wants to jump in.
I'll start with that. So one of the things that's becoming clear for a number of the people I work with is that we've hired sales professionals that are behaviorally wired to enjoy autonomy, variety, and variability in their day. So Monday might be traveling to a series of appointments in one market, and then we might be getting on a plane or doing an overnight to go into another market and do the same thing in the next day. So they thrive on the variety. They thrive on the engagement with different marketplaces. They're not getting that now. And so there's no evidence that supports a date in the future which they will get that, or if we will ever need that in order to effectively sell. So there's arguments that you can't replace the face-to-face interaction. There's also evidence to support that you can sell through these telecommunication platforms, and that there are teams and there are people that are actually wired differently to sell better. So what does that mean? So many of you are going to go back to selling as normal, and you've got a team that's wired for travel and remote and autonomy, but yet what's required day to day is more predictable activities, doing the same thing day in and day out in a structured, stable environment, and you've got a team that may not be wired for that. So you've got to make a tough decision with really good people as to whether or not your go-to-market strategy 6 months ago is the best, most predictable and reliable go-to-market strategy now and for the inevitable future. And with that, not only are you going to have different types of people performing the business development and the relationship management roles, but you're going to find that the economics are going to shift a little bit too. And I'll elaborate on that. So you're going to have some budget that was expenses related to travel and entertainment that you need to reappropriate to maybe technology or sales enablement tools. And it might not be a good practice in the foreseeable future to to budget so much travel and expense. Salaries and wages may in fact go down. You might find that to do the same work in Zoom, to have 10, 12 Zoom meetings a day versus 4 or 5 face-to-face, you might actually be able to get someone at a lower price range to do that and still do that effectively.
Yeah, I'd just add to that too. I think the concept of the traditional territory in our space is kind of old school in a way. It's still very geographically defined. It's based on drive times and space. But as we were really, putting our ear to the ground and seeing what might be coming down the pike, the idea of being able to have a national team based off of different regions is starting to become more appealing, where you can now be a rep in Nashville and drive and meet your appointments and have your lunch and have your coffee, then pop on a Zoom with an account in Oregon. And your manager who lives in Florida could be on that account with you. And all of a sudden now you have a new concept of a field ride, and you have a new concept of territory management and account management. So I think the interesting thing about our line of work is sales as a whole is relatively unchanged from the beginning to maybe the 70s, 80s. But all of a sudden, since then, with telephones and then with cell phones and computers and now these FaceTime things, we have a whole new construct to do our job. And it's important for us to realize that, and how you're planning as an individual, how you're planning as a leadership team is going to determine how do your territories look? What do your activity metrics change to? Do they change? Do you, like Nigel said, is it a new type of rep that you really need to grow at a different rate? So I don't know if those answers are completely out there yet. It's obviously dependent on your organization and your goals, but I think that we will start seeing more of that in our space. And I wouldn't be surprised that if I have a rep in Chicago interacting with someone in North Dakota that they never meet but are able to find a good treatment partner with.
Yeah, I mean, the true definition of a sales territory is essentially the assigned accounts. And so that was one thing that I uncovered back in 2012, is that largely the division of work, the geographical territories in this industry is antiquated and outdated, and I never have subscribed to geographical bounds for a sales rep. So I think the quicker you can shift to a more account-driven territory model, where again, your territory, everyone has a territory, but it is a list of assigned accounts and prospects, and it's irrespective of geography, the better chances you have to quickly stabilizing your referral sources and beginning to see traction with inbound referrals. I think now's the perfect time to just blow up some arbitrary geographical divide, if you still have them.
Yeah, agree with that. Jamie, just a little insight. We asked what I know you're having technical difficulties out in Nashville with the storms and everything. How do you think Zoom and teleconference platforms industry going further?
Yeah, it's an interesting question. And can you hear me okay, Doug? You're in the storm zone. It's crazy over here. It's an interesting question. It has changed things for some people. And then I think for a lot of people, it hasn't changed anything. And I think about, my business and how I have conducted business for the last, 4 or 5 years. It's not a lot different, except for now it's just those face-to-face meetings are kind of off the table. But the cadence of my work hasn't changed at all. I mean, I've been doing Zoom meetings and video meetings for a long time. And so I think that, yes, there's a bit of an adjustment there. I'm kind of glad to see that, just running by and dropping off a brochure is kind of off the table now, and I think that what I'm seeing is that we are really going to have to go towards effective sales measures and really polish those skills of, why would somebody want to be on a Zoom meeting with you? What do you have to say right now? Because if you drop by somebody's office, real quick, which is, unfortunately a habit a lot of people do, you can just kind of say, hey, but if you invite them to a video call, that's intentional. And so I feel like the technology is awesome. It will change. I think what I'm seeing it change is the intentionality, because if you invited me, Doug, on a Zoom call, I got to think that you've got a big reason that you want me on that, not just to say, kind of, hey, what's up? So I think that it removes a lot of the arbitrary activities, and I used to tell my teams, we don't get paid to eat cheeseburgers and play golf. Our job is to go out and listen to our accounts and provide relevant information. I think now we're able to do that in a certain reach. I hope I answered your question. I fear I missed part of it, but that's what I think about the part I picked up on.
No, that was right on time. I like that.
Looks like there's a question, Doug.
Do we got a question? All right, let's take a look here. Good morning, everyone. I have a question. How long does Steve think, and this is from Shayna, how long does Steve think it will take to roll out all 4 phases of the reopening sales team? And as we get more info on what that will look like.
Yeah, so obviously all this is flexible. I mean, it could change in a heartbeat if cases spike and everything shuts back down again. But optimistically, it'll probably end up taking, there's a full rollout for the entire team, 3 months. And I say that because the 4 phases are meant to really be a 2-month process. But the caveat is this: if a rep, let's say my rep in New Jersey State doesn't open until June, it's well known they're not opening until June, and for good reason, they don't start phase 1 until June. So while I have a bunch of my team on phase 1 in May, some of the team will be on phase 1 in June. I can't suspect anyone will be July, but ultimately phase 1 should be the month of June, or month of May, I apologize. Phase 2 will be the first half of June, and phase 3 will be the second half of June, then phase 4 is business as usual. And then one thing I did mention, I forgot to mention with that on the caveat is, this is all for us, this is a maximum. So if we have reps who don't feel safe going out in the field due to their own health concerns or family's health concerns, or if they are finding that they're more functional on this sort of work environment, and we're agreeing with that, they don't have to go out and go to these face-to-faces and have cheeseburgers and golf like Jamie said. They can do what they need to do. I'd be more glad to talk in more detail about the phase system. I'm just hesitant on actually sharing the full thing. Last thing I'd want to do is send it out there and someone's organization accidentally, they roll out my plan, their rep gets COVID and I get sued. I don't really have a lot of time for a lawsuit right now, but I'd be more glad to walk through it and the thinking and the methodology and all that stuff behind it gladly.
Anyone else got any points on that? On what the timeline they think is going to be on the whole rollout of all the stages?
I certainly, can't advise on that and wouldn't, because I'm waiting for my own rollout plan, and for me, that's dictated by somebody else. And so I'm a rule follower, so I'm going to hang out and see what happens. But I think an important point is that I know for myself, I'm not, that when that happens and I'm able to go sit down and at Starbucks with Nigel, that's going to be great. But that doesn't change the fact that, I'm in front of my customers right now, seeing what they need. And I now more than ever, want to listen to them and find out what's going on. I think that, if it were me in that position of having to think about that, I would want, more importantly, like, what are we doing like right now today? And then I think that, we keep up a high amount of really relevant and meaningful activity. And then when the day comes that we can go out in the street, then we can go out in the street. But I just keep thinking it really resonated with me on Nigel's points of, evaluating the marketplace. I think that one thing I learned a long time ago from a guy that's on this call is that, there's a time to work on your business and a time to work in your business. And we've been given a bit of a blessing. And I've seen a lot of organizations take advantage of it, in that we get to now it's kind of paused and, people are spending more time with their families, blah, blah, blah. Well, it's just kind of forced that. I think also as organizations, you're able to sit and evaluate and look, strategize and plan. And that's what I would be doing right now, is to kind of plan, but that plan needs to be told almost to me by listening to the marketplace and evaluating the marketplace, because I don't think it's going to be the same marketplace to re-enter. I just don't, nothing is telling me at this point that it's going to be.
Yeah, so here I'll just take that and run with it. Yes, you should be planning. I coach about 20 sales and marketing executives in my practice now, and without exception, every one of them is doing some viability testing with their sales team. And so what does that look like? They're seeking credible information about the industry and the market. The industry and market, as Jamie has changed forever. The degree of change may vary from market to market, from offering. So whether it be residential or maybe you've got a telemedicine offering, but don't kid yourself, it's different now. I think at a minimum, the demand for your product and service will not simply turn on or reboot whenever you're ready to. Limited incomes, anxiety about being around others, and wrestling with the other competing business priorities are going to disrupt traditional demand for your offering. I think it's important to remember that some portion of demand may no longer exist. So I would have your sales team looking at referral partners and other referral sources that you previously relied on to make sure that they're still going to be there. Some may not reopen. A thoughtful evaluation of your market and make smart choices based on data, not historical averages. So your historical averages of referral patterns will not serve you when you go back. So questions I want you to think about are, what markets are you vulnerable? Are your former referral sources in a position to relaunch with you? How has demand for your existing or old products and services changed? What new products and services are you prepared to launch? Is your sales team trained on those offerings? And how has this pandemic affected your overall sales team? Are they still viable? And do you have the right people in place to launch these new products and services or go into the market in a new way?
Yeah, exactly. And to that too, one thing I left out is that, I'm kind of the practical kind of, pretty simple. Everything I do is very simple, but the market research piece is something that I don't take lightly. And, for instance, how that looks in real time right now to you behavioral health folks is that, most everywhere in the country, one of the major call points was a case manager at a hospital. Well, go call them right now and see what they say. And most of the time, they're going to say right now is, well, there's not really any patients in here with substance abuse. And that's because a lot of hospital systems we're finding right now aren't taking them. They're not doing the detox. They're not, some may, I don't know everything, but some aren't. And so that whole account has changed underneath your nose. And now it's the charge nurse in the emergency room, the triage nurse. They're now the person that you would go talk to. I mean, but that's just one tiny segment. The same for EAPs. That's changed right now. Across the board, everything is kind of changed. So the same thing that you would go to somebody about before is going to be pretty irrelevant if you just, say your state gets opened up and you get to go do whatever you want. You can't just follow your same game plan.
Inevitably, there's going to be someone bringing a box of donuts to a case manager in a hospital this week, and it's not going to fly well.
So Andrew Bramlett has a question in the Q&A. It says, I hear a lot of people asking, when can we go back to business as usual or normal life? How likely do you think it will be that our profession as we know it has significantly changed long term? I think that your profession, and so in the broader addiction treatment, I question the viability of travel for treatment just because of customer sentiment. I think that forced into telemedicine, even though there's a lack of fidelity for a lot of the delivery methods, has changed patient perception about that type of care. And then more specifically, as it relates to selling in this profession, I think it's forever changed.
Yeah, nuts and bolts around that. What I'm seeing right now is that It's not. I really want to do some thorough research, but just as the naked eye, what I'm seeing is that some centers are having their best months ever, and I think that's more of a regionally based thing. I don't think that there's a ton of people hopping on airplanes that I'm aware of, but some centers are continuing to really thrive. I think too, what I'm seeing from the telemedicine piece is it is extremely viable, but it presents a whole nother set of things. Like, one of the programs I work with, we launched a really awesome and robust telemedicine platform. We really thought through the engagement piece around it, to where you need to really um, almost do it for them in terms of engagement to get them started in treatment if they're in treatment. And then post treatment, you really got to walk them through it. But even then, kind of compliance, so to speak, with that has been hard. And then when you have lack of compliance, you have lack of reimbursement. So there's just a lot of things to overcome and to learn and to figure out. And I think that we're going to be learning that and figuring that out for a long time. I think that the people that are going to have an advantage over that are the responders versus, the reactors. I think in a crisis situation, you've got, kind of victims, bystanders, and responders. And the responders right now, we're in healthcare. We're in a pretty important part of healthcare. We should be getting together and innovating on this stuff because it is ultimately what we sell.
So, if you think about if you're pivoting into more of a telemedicine delivery, your ideal customer has changed, right? I mean, the unit economics of the way that telemedicine product works is obviously the reimbursements and the per diems are fractions of what they are for other types of or other levels of care. So if you're selling a telemedicine offering, I mean, you just can't generate enough patient referrals to cover your cost in the way that you have been, like 8 or 9 telemedicine referrals a month, even 10 or 12. It's not sustainable for the business. So you're going to have to call on a different type of customer that is capable of, providing you 20, 30, 40 telemedicine referrals a month. And so it's just, Andrew, it's forever changed the way you think about selling.
So I'm going to be a little more optimistic. And I think for me, I'm going to compartmentalize telemed in a different box. I think that's something that will change forever in our space. And it's due time. I think we needed to change and grow telemedicine and behavioral healthcare for a long time now. I still don't think it's the laws have completely opened it up the way they should. There's still people all over the country who are in these rural areas who just cannot get treatment. But from the concept of residential treatment, we've been fairly blessed to still have a lot of people traveling all across the country, all west, from the north. If I were just taking a stab at our rough numbers over the last 2 or 3 months, my south region and my north and west regions have been pretty equal in total number of admissions. So it's still a pretty baseline source. I think it'll be the heaviest burden on the ops teams moving forward of pandemic prevention, awareness, testing, what practices they do to overcome the challenges with this. I think a lot of those things are going to be on their shoulders. Similarly, pickups, sometimes an hour pickup or airport pickup might turn into 4 or 5 hour pickup because of the concern for flights and people getting on planes. But, humans tend to have some relatively short memory. So within a year or two, a lot of these things will start softening and softening. And I think they'll go back to some normality. But the challenge I see coming from this isn't necessarily on the patient behaviors. I think patients will ultimately always try to find the best treatment per center possible based on people they trust, referral that is working with their insurance. But the insurance providers during all this, they're going to come out on the other side of COVID and have a really hard look at how they reimburse. And I think our industry is going to see some challenges from that. I've always been a proponent that we do it really wrong in this industry, ultimately for the patient, with the statistic, 23 million Americans meet medical necessity for inpatient treatment, 3 million a year get it. We're all very content treating the same patient around year after year. when in reality, our job really should be going directly to the providers, directly to the companies, the corporations, the businesses, the lives themselves. And I think the companies that do that really well and really build that team up during this time are the ones who are going to be able to survive without geographical restrictions.
Yeah, I agree with that. And piggybacking on that, I mean, whenever we're going to see a change in the industry, but I do agree that we're going to kind of go back to normal. The one thought I do have is kind of more towards you, Steve, is a lot of people are having a hard time with this, and they're having a hard time maneuvering through this landscape. And my question always is when is a good time to start considering a consultant or someone to kind of be an advisor for you on how to maneuver in certain parts of this industry, or help with the tasks that you just quite frankly, don't have the time to do? When is it kind of the buildup for that?
Yeah, so I look at consultants in two ways. I think the recruiting side of things, we've already been working on that, trying to regrow how we recruit and how we train people. Similar to that, onboarding limitations are definitely going to be in play right now. If you think about a really robust onboarding procedure, you might be at your treatment center for a week, you might be in your call center for a week, you field ride for a week, you have someone field ride with you for 3 or 4 days. That probably shouldn't happen for a while. So how do we leverage tele-training, tele-onboarding? Consultants, I think in this instance, could be very well suited to take that weight off of the sales leader. So the sales leader can step back and really see what they need to do to remove barriers for their team. And then I think, as I was talking earlier about my team's plan of having my directors and myself getting together and doing a reset, I think a facilitated reset would be a very beneficial thing. So just seeing some people on this presentation, I think some of y'all have organizations that have many other sales managers, sales directors, sales leaders coming together, be it virtually or in person, and utilizing a facilitator consultant-led session to reset and open, kind of take a step back and open your eyes to potential roadblocks, barriers, and opportunities you might not have thought about. I think that's a very good use of funds and of time. And I bet everyone on this call can reallocate a few $1,000s from a conference that we were going to a consultant right now. So I think that's a much better use of spend to get the team in a smarter, more nimble place.
Nigel, Jamie, you guys got any feedback? Thank you for that, Steve.
Not necessarily on, a consultant, but I just think that in general, we all, yeah, it's almost like a non-discussion for me since I've been for the last probably, I don't know, 10 or 12 years, I've had my own coach and I've had, my own consultants, and Nigel's one of those. And so it's just the way that I think. I'm constantly bringing in, outside sources because I know, how limited I am, which is pretty limited in some ways. And so I think that, more than anything, I think evaluate what your strengths are and evaluate where you need help and get help where you need it. And I don't know where that would be for everybody, but, really be honest, and do kind of an inventory of your organization right now and see where you need improvement. I know there are a few companies I'm working with out there that, brought me in during this time to just, kind of sharpen the skills on the business development team. And because, I was a leader of a business development team for a long time, and that, it's you train and coach as much as you possibly can, but I want my team to have training all the time, and it was never a reflection of me. So what I always did was I hired coaches for my teammates, in a lot of instances, if they, merited that, and a lot of them hired their own. It's just, I think that coaching and training should always be taking place. And sometimes there's an area of company that you need to grow, and you need to bring somebody else in to do that. So, that's just what I think about the concept in general. And that could be for free or you could pay for it. But I think that right now more than ever, it's reaching out and, seeking information and input.
Yeah, I agree with that. Nigel, anything on this or?
I think that there's, if my business is any indication to the market's reception to having their plans reevaluated, then I think now is a good time for it. I at least once a week spend a day with a sales leader going through and auditing people, processes, strategy, and the budget to make sure that when whatever the new normal is, that they feel confident that their plan of attack is going to be adequate and will serve the people being the business, the people that are giving care, the sales team, and the customers. And that's it starts with making sure the job descriptions that you wrote 6 months ago, or maybe for some of you 4 years ago, are going to be relevant today. Making sure that the comp plans, although heavily regulated, are still viable, that the right things that we want to measure are still being measured. Do we have the right tools to support this team in a virtual environment? There are a lot of questions that you need to have an answer for, and sometimes the best way to get the answer is to go outside of your organization, get outside of your brain. And to Jamie's point, sometimes you pay for it. Sometimes you can just find a friend or a colleague and mastermind it together. But you have a responsibility to get the answers. It doesn't require that those answers come from you.
Yeah,
And
go ahead. Steve.
quick on Nigel's note about getting out of your brain, it's a little off topic, but just a strong recommendation that we've all been just hyper focused over the last 2 months on COVID and growth and all the little things that are going on. And if you're like me, this is like, I think my fourth video call of the day already, and it's back to back to back. Be sure you and your teams are taking time to get a breather, especially this month, before we start opening back up. I did it last week. I took a day out and no work and just completely refocused on opening my brain back up, and felt a world better, felt completely different getting back at it again. And I suspect that our sales teams and our sales leaders are all also hyper focused for the last 2 months and could use a chance to reset their brain. And I think a lot of clarity can come from that.
Yeah, I agree with that. I agree with that a lot. I do have this question. What do you think is the biggest value add whenever we're starting to relaunch into the market? What's the biggest value add you can do with your referral sources and people you work with so that you guys can launch kind of simultaneously and really be working together on this? Because I know that the market research will show that if you're opening up before other people are ready, you're going to kind of come either to the market too fast or too late. So I'm thinking, what are some of the biggest value adds you guys can do for people you work with already?
You mean as far as like the referral sources, Doug, or like our consulting clients?
I'm sorry. Let me clarify a little bit more, like referral sources and, kind of your strategic accounts. What are your biggest value adds for your strategic accounts to help them open up in a pretty similar fashion as you?
Yeah, I think it's gonna, go ahead.
I was going to say, I don't think it's changed, right? I mean, so the reps and the teams that were performing well before were empathic listeners. They viewed themselves as an extension of their referral sources business. They were already contributing to the way in which their customers solve problems. That hasn't changed. So the fundamentals won't be changed at all. The context has changed. So I think that if in the midst of all this change, I would be confident and comfortable saying that that's one thing that's going to remain the same. So if you have truly a heart to serve, you're in a good spot, because that will be business as usual. And the best way to add value is to show up and serve. I don't know what it's going to look like tactically, but if that's your mindset, is that I'm here to serve and I'm not worried about hitting my number or getting my place back. Yes, you are, but if you can quickly find ways to connect your goal with ways that are going to change and improve the situation for your customers, I mean, you got a leg up on a lot of people.
100%. I think, as an organization level, I kind of had the same talk with a lot of different companies initially around this, and the talk is that this is, a defining moment, and it will define you and your company and your leadership. And the only thing to do right now, the only thing is to see where your place to serve is. Um, and that's it. Where can you be helpful? And if you do anything other than that, you're going to lose time and you're going to lose footing. And so there's, a couple different responses. One is, we re-enter the marketplace running around looking for ways that help us, and I think that can go in a lot of different directions, either in like the fear, either we're overly fearful about protecting our organization or whatever that may be. I don't know. Or, so we're slow, or we're too fast and, we just run out there. I think that, again, it's been said several times. I don't want to be a broken record, but, really that empathic listener. I think the thing is that it's really going to shine a light on the skills, like Nigel said. And one thing I would do right now is to try to increase the waterline of the skill set of my team. So more than ever, communication, really the listening skills, the true sales skills are going to be more important than ever, because I will bet on this, it's not going to be a situation to where you can just run around like fish in a bowl in your territory and just grab up, insurance policies and send them in to treatment. I don't think that that's what we're going to be seeing. So it's going to separate the ones who are truly good from the ones that aren't. And, I think it's a good time to kind of sharpen the saw, steal one from Roy Jordan. So that's what I think.
Yeah, and the guy who sends the text out to 50 places says we have open beds probably isn't getting it right now. I don't think that's the right behavior. The only thing I would add to those first two comments is I'm a strong believer of organizational relationships, and the thing that's been the most different for me over the last 2 months versus the last 3 or 4 years is I've been having a lot more ops and clinical directors and more people on the medical side of things reaching out to me to connect on LinkedIn and try to connect with my medical team, my clinical team, my ops team to find ways to collaborate for the best safety of the patient and the best safety of the teams. So I'd be a strong proponent of, if you had to add anything to it, making sure that you're aligning yourself with good organizations and doing it not just rep to rep or rep to admissions director or whatever, but organizationally when the opportunity presents itself.
Yeah. I mean, I think those are all really valuable points, and I think it is going to be about being of service going further. So I definitely totally agree with this. This is kind of just a question I have. What do you guys think conferences are going to look like in 2021? I'm just interested to hear what you guys think about that.
Don't
2021.
I think this year people are going to want to go because they're tired of being at home all the time, but won't. So they're going to be kind of light this year. I think we've already seen it this year. We've already seen some conferences phase out. I mean, Moments of Change wasn't even COVID related. Core, I think, is obviously, and some of the bigger conferences aren't as big conferences anymore. I think there's still a utility in them, and probably not as much as 5 or 6 years ago. But I think next year we'll see conferences that provide the right value thrive, and the conferences that were just attended, and I think we all know of a few where it was kind of an obligatory attending, that just won't have that next year. So again, it kind of goes back to I can't remember who said it earlier, but the good sales reps are the ones who are going to thrive through this. People who are talented, ethical, moral, the up and up, and can work through this. They're the people who are going to thrive. And I think the same thing goes with the conferences. Those who are good, provide great value, have the right forum for what we're looking to accomplish. Those are the ones that are going to really thrive.
And I'll add on that. Do you think it's going to be something where you're going to want to send your reps to? It used to be that you kind of wanted to get a lot of exposure at every conference. Do you guys think that's going to be the model going forward?
It just depends on where
No.
you are as an organization, I think. I mean, I think that if you're brand new on the block, it might not be a bad idea. I mean, me personally, and this could just be my personality, so take that for what it's worth, but I find myself to be more effective outside of that environment. Now, there's some that I like to attend, but I'm really clear with myself about why I'm going, and socially is kind of a driving factor. And so, I get to choose where I spend my money, and so I'll go to one, but I know that, you know, however, I might leave with business that, also a big part of it is just to connect and kind of maybe reward myself for a good year or whatever. Um, but I don't know. I prefer going and setting up shop at Starbucks and having back-to-back 30-minute meetings all day and really getting some stuff done. That's my jam. I mean, but that might not work for everybody.
Nigel, you got anything on it?
No, not really. I mean, you guys
No,
know how I feel about conferences.
not much on conferences. All right, let me ask a different question that I was thinking about. We have, I think the number is about 20 million unemployment right now, and that we're going to see a lot of people lose their insurance benefits. That's something that I've been thinking about as a business owner as well. What do you think the best tactics are going to be to combat that, as well as kind of look to different markets so that we're not losing out on such a huge, I hate to say, but customer base?
I mean, personally, I think it's another defining moment, and I think that yes, there's that piece of what will we lose, but I think that it's our job to come up with that solution for those people that lost their jobs and just for them to still have treatment. I think as leaders in this industry, I think that's what we're supposed to do. And so I bet you that somebody will rise to the top and come with that solution, whatever it may be. I know that there's a company out of Los Angeles that's doing free telehealth treatment. They already had this platform. That was their platform before. Right now, they've identified that people have lost their benefits. And so they've got a version that's an IOP curriculum that they're offering out for free, in addition to, their paid products. So I think that hopefully we'll see some stuff like that. I know that myself personally, that's a really strong feeling for me, that I feel like, it's my responsibility to come to the table with some solutions right now. And if the problem is that people lost their insurance, well, what can I do for those people? And I don't, good, bad, or indifferent, I kind of worry about the rest of it later.
I just put a link to an HBR article in the text, so you guys should be able to access it and grab it. It's from 2001, but it's really relevant now. And so I don't know, I'm probably not qualified to talk about offerings for unemployed patients, but I know this. I'm really excited about the talent market. It's a market that has shifted dramatically with the number of unemployed people. I used to have this saying that I don't hire any salespeople that are unemployed or out of a job because they didn't do their job well. That's not the case now. So you throw that out the window. There's some really talented people that you can grab and put on your team now that are just casualties of this. And if you're not interviewing people, if you're in the sales role, even if you got a full team, you're not interviewing people, I think you're doing it wrong. So read that article, and I hope that you take this as a chance to find some really good people.
Yeah, and on that note, we definitely are. I'll tell you, that's one thing that I'm optimistic about coming through all this, is that we were looking to grow at the beginning of this year anyway, and now is a great opportunity to grow with the right like-minded people who want to do this, and whose organizations might have not been supportive of them through this time. It really blew me away how many organizations let their teams go 1 week into COVID. or something like that. So it's a good opportunity for growth. I think from that 20 million number wise, my projections, what I'm really looking at is I assume a large chunk of those are the short-term layoffs and the furloughs that will be coming back probably within the next month. I sincerely anticipate an uptick in calls in that time. People who have been under the radar. I think the ABC posted something by the New York Times that liquor sales are up 244% over this time last year. We're going to see people who are day drinking and really off the rails at home going back to work and now in public are identified. And I think through June and July, we'll start seeing a big uptick of those people coming in who have benefits, but during layoff or furlough, they were there. The rest of them, and I'll lean on another webinar I was on with an economist, and he was saying the cold-hearted economist of him believes that, yes, a lot of these businesses are going to shut down, but like in every other free market system, another business will take its place. And the rate of that, obviously, is the question that we have. And this gentleman was predicting a sharp V uptick, so maybe an 11 to 15 month return to baseline of, let's say, January 2020. So, for a short term, we're going to have a really difficult time with a lot of unfundeds. And I think we need to rely on our treatment partners and do what we can as treatment organizations to help where we can. But at the same time, recognize that that things will fill the void and things will still grow. And like I said earlier, if we can take the time as an industry to get right in front of the people directly instead of just relying on each other's Google searches, we'll be able to access these people and get them the right help.
Yep, I agree with that. But we're winding down a little bit, so I just want to ask a quick question. I know both of you guys are really particular about your reps and who you guys hire. What are qualities that you guys look for in a rep? I always find it interesting to kind of ask this question because everyone's got a different criteria. So I just kind of want to finish with that and just see what you guys have to say about that.
Yeah, I can get hyper detailed on that one, but
I'm going to go quickly because I got a hard stop coming up. So, you can read this in the book. There's a whole section in my book about talent management and selecting the right people. But I hire on 3 C's, and they're in this order of importance: character, chemistry, then competence. Most hiring managers start with competence. It's the least important to me because if you have the right character and the right chemistry with me, you're going to develop the competency that you need to be successful. Character is really about principled living and what you do when no one's looking. Are you someone that I would trust with my kids? Can I trust you with secrets, and can I trust you with sensitive information? Will you do the right thing? How well do we get along? And for someone to get along well with me, they need to be a reader. I think that readers are leaders and vice versa. Leaders are readers. If you're not reading, if you're not learning, we're probably not going to get along. So those are the things that I look for: character, then chemistry, then competency. And I got to go. So thank you all for having me. Let Steve, I'm sure he's got something far more insightful. I'm going to run. See you guys.
Thank you, Nigel.
So we used 3 different things, but the same vein: integrity, passion, and ability. I think you have to have all 3 in this space. But since this is a small group, I'm going to share with you guys my hidden 4th. Nobody on interviews knows this 4th one that I do, but my biggest 4th quality is I'd have to not want to compete against you in the field. If I'm interviewing someone, they have all 3, and I would not want to go against them competitively, that's the person I want to hire. I want to hire the person that would give me fits head to head. And a lot of times I've hired my competitor reps from many different industries who have given me fits because that's the person I want on my team, challenging me, pushing me, and helping me get better as a leader and a salesperson. So that is it for me.
Yeah, love it. Steve, once again, thank you, Lakeview Health, for allowing us to use the Blue Jeans platform. Really, really appreciate everything you guys do out there. I think I don't know if Nigel left his email or if Jamie left their email, but I will leave mine.
I left mine, so if any of y'all want to go through the rollout plan we did, shoot me an email. I'd be more than glad to get a time. And also, if you guys know anyone who is looking for opportunity and business development in our space, we are growing. So shameless plug for our team.
Yeah, and this was recorded too, so if anyone wants to get this sent to them or wants to view it, it should be on the Lakeview YouTube, correct? Is that kind of, are you going to put it on there or?
Potentially, but if you want it, we'll send it out.
Perfect, let's just do that. All right, thank you guys, and thank you, Steve. You guys are awesome. All right.
Y'all have a great
Talk
one.
to you later.